Commissioner. I'm here, want to talk with you a few minutes about this so-called Blue Cross bill, House Bill 346. And I tell you, this is how I heard about the bill. I guess the day the bill was going to be filed in the legislature, I got a phone call. It said, Commissioner, Blue Cross is going to be filing a bill this afternoon, and it already has the support of the leadership in the House and the Senate and the governor. And the bill's going to pass. It's a done deal, so you might as well get on board with it and not be out on a limb like the Lone Ranger. And I said, well, that sounds good. We'll certainly take a look at it. And when the bill was filed that day and we took a look at it, we did a very deep dive from all of our subject matter experts, our attorneys, our actuaries, financial folks. And I'm here to tell you there was nothing good for North Carolina consumers or Blue Cross policyholders in this proposed legislation. I made a few notes, and bear with me because it takes a few minutes. I want to make sure that I'm clear on the main points. And the main thing, when I first saw the bill, you know, I questioned why the bill was needed to begin with, because they can do about anything they want to under current regulations. They just have to do what's called a Form A filing, which is subject to public records. But I had 4 major concerns with this proposed act. Number one, this bill will allow Blue Cross North Carolina to transfer policyholder surplus from the Hospital Service Corporation, which is the insurance company, to an unregulated holding company. Number 2, it allows Blue Cross to circumvent statutory limits on reserves that would otherwise require money to be returned to policyholders or reduce rates. And everybody that's looked at it, including myself, will argue this thing is going to raise health insurance premiums for everybody in a Blue Cross plan. Number 3, it gives the Department of Insurance no oversight, none, over the holding company. Number 4, it has no limits on how policyholder money is invested by the holding company to ensure that that benefits North Carolina policyholders and citizens. And let me be clear, Blue Cross is fundamentally different from a for-profit insurer. These are the people that it wants to compete with. It says it can't compete. But Blue Cross was created and organized as a nonprofit corporation, and for decades they enjoyed a lot of tax advantage in this state that other insurance companies didn't have, and it was created to offer health insurance to North Carolina citizens. Blue Cross North Carolina's nonprofit status and how the proposed reorganization impact is what's at the heart of my concerns. And unlike for-profit companies, nonprofit corporations cannot raise capital through stock offerings. Every bit of Blue Cross's $7.7 billion, now that's billion with a B, for those of you taking notes, that's $7.7 billion in admitted assets and $4.6 billion in surplus. Every bit of that is either directly or indirectly North Carolina policyholder money. And there's taxpayer money there because of the Medicare and Medicaid involvement, but the investment of policyholder money should be for the benefit of North Carolina policyholders and citizens, consistent with Blue Cross North Carolina's mission. Now, I don't believe that Blue Cross has a problem competing with for-profit companies, and if you look at Tunde's LinkedIn page, it admits Blue Cross is the largest health insurer in North Carolina. It's by far the largest health insurer in North Carolina. In the individual market, and this is from 2021, Blue Cross North Carolina market share was almost 83%, 82.8% to be exact. And in the group comprehensive market, it's nearly 80% market share, 79.6% at the end of 2021. Now, Blue Cross says this reorganization is necessary because it's limited on how it can vet and invest in other companies by existing statutes that do not apply for-profit insurers that are part of a holding company system. Well, I will argue to you that as a North Carolina nonprofit, Blue Cross should not be able to invest policyholder money with the freedom of a for-profit company using investor money. There's already a path available if Blue Cross wants to compete with for-profit companies and pursue investment opportunities the same as the for-profits do. And this is not the first time that Blue Cross has come to the department and the legislature arguing that changes were needed to allow it to better compete. In the late 1990s, Blue Cross North Carolina wanted to become a for-profit company, and this is what resulted in our conversion statutes, and these statutes created a way for Blue Cross North Carolina to become a stock accident and health insurance company. House Bill 346 would allow Blue Cross to transfer the entire ownership interest in the Hospital Service Corporation to the holding company, a new and separate legal entity, without having to provide a benefit to the people of North Carolina equal to the fair market value of the company, as would otherwise be required by the conversion statutes. So the holding company created pursuant to House Bill 346 would not be regulated by the Department of Insurance or any other entity. For-profit stock companies like those that Blue Cross mentions as competitors, those companies are subject to oversight by the Securities and Exchange Commission and must answer to their shareholders. You don't have to think back too hard when Dr. Conway came in here. It wasn't long after he got here, they were up in my office wanting to do a merger with these insurance companies out in Oregon and Washington State and Utah and Idaho. And I thought it was a crazy idea, but we listened to them and we talked to them, and that ultimately went away. But once the holding company is established and it controls Blue Cross North Carolina, the transactions between the two companies are governed under General Statute 58-1930. And under this statute, the department only has the authority to disapprove a transfer of funds from the insurer to the holding company if, that's a big if it found that the insurer's surplus was no longer reasonable in relation to outstanding liabilities adequate to its financial needs. Currently, and I've said it earlier, Blue Cross's surplus is over $4.5 billion, $4.6 billion. So they could transfer billions of dollars of policyholder money to the holding company before that surplus reached the point of being unreasonable. The bill also allows Blue Cross to avoid limits on how much reserves the insurer may hold. A statute, Chapter 58, 6595, limits Blue Cross's contingent reserves to no more than 6 times its average monthly expenditures. And currently, if that threshold is reached, Blue Cross is required to return the excess amount to the policyholders, either as a refund or reduced rates. But under this bill, Blue Cross would be able to reduce those reserves just by transferring the money up to the holding company instead of returning it to the policyholders. So again, this is going to cause a significant increase in premium rates for policyholders, and once those funds are transferred to the holding company, the Department of Insurance has zero regulatory authority over how the holding company invests those funds. The holding company is exempted from the limitations of the conversion statutes. It does not have to comply with those investment limitations. And my concern is that North Carolina money will be used for investments that don't benefit North Carolina. They might want to decide they want to buy that company, insurance company in Oregon or Washington State. Nothing you can do about it. There should be limits on how the holding company can invest its policyholder dollars to make sure they invested. So it should be subject to the limitations in the conversion statutes. It's my understanding that with this proposed reorganization, Blue Cross, and this sounded good, they said we'd like to invest more in rural North Carolina and help, and I guess that's where the economic development part came in. But if that's what they want to do, why don't we spell that out in the legislation and give the Department of Insurance regulatory authority over those holding companies? I think that this legislation is missing many provisions that's necessary to protect the people, the policyholders, does not provide for a meaningful review of reorganization. The reorganization is simply the creation of a new and separate entity, a legal entity, that will become the ultimate controlling person of Blue Cross North Carolina, the insurer. And that means a change of control of the insurer. But even with simple corporate transactions, the devil is in the details. I said with this bill, the devil's in the lack of details. But for any insurer, this type of change goes through what we call a Form A filing under Chapter 581915. And this legislation exempts the reorganization from this process, which essentially requires my approval of the reorganization without allowing for any review. To the extent this proposed act and the proposed committee substitute that we've seen require my review under Chapter 581930, this is not the appropriate standard. Like any other insurer, review and approval of this transaction should be under Chapter 581915. I've been told, and it's been stated, that what Blue Cross North Carolina is asking to do is just a reorganization, because the new holding company will have the same mission and the same board of directors as the current Hospital Service Corporation. If this were true and were to remain true, I can understand exempting the proposed reorganization from triggering the conversion requirements. But I've requested these assurances from Blue Cross, and none of them have been accepted thus far. So there needs to be clear requirements that the holding company will have and keep the same mission that Blue Cross North Carolina currently has, the same board of directors, not just when they reorganize, and will always be the direct parent of the Hospital Service Corporation. The proposed act must give the Department of Insurance jurisdiction over the holding company, and there should be reporting requirements for the holding company, not just requiring financial statements. And I'm almost finished, but without stronger reporting requirements, we will not know certain things about the holding company that currently is being reported to us by Blue Cross, like what it pays directors and executives. And I'm thinking, well, if they're paying $1 million bonuses to executives every year and can pay $6 million to a CEO when we're looking, what can they do when we're not looking? So publicly traded companies have to file a Form 10K with the SEC. And the holding company should at least have to make a public filing the same as these other companies under the 10K. But I'm fully committed to supporting Blue Cross's mission to provide accessible and affordable health insurance to North Carolina consumers. And as I said initially, I question why this legislation is even needed. So my staff and I have spent a lot of time with Blue Cross attorneys, the Attorney General's attorneys, and I've shared our proposal. I think they gave us 1 out of 5 items that we requested in their proposed committee substitute. But as a nonprofit company, Blue Cross North Carolina is very much an asset of North Carolina. The General Assembly recognized this when they enacted the conversion statutes, and any request to reorganize without being subject to the conversion statutes must be considered carefully. And I just hope that we can convince our legislators to slow this bill down, take a hard look at it, and we will answer questions. But I see we have State Representative Donna White. Donna, if you would come up and speak with us a minute. Donna White's a nurse. She's a representative from Johnston County, and she was telling me a little while ago when she left Raleigh Friday, her email was clear, but when she came back this morning, she had a whole stack of emails. So Donna, would you like to share your thoughts on this bill? Thank you.
Thank you, Commissioner. Thank you all for being here. And I do have to correct the Commissioner. I said that at 8 o'clock this morning, I had stayed up all night and finished all my emails. And then when I got back from a meeting at 10:30, my phone was packed again. So it is, a lot of people in North Carolina are concerned about this bill. I am speaking today not only on my behalf, but other health chairs have asked me to share the fact that they're concerned as well. There were some health chairs that were feeling maybe it was okay, and some have decided that we need to have a little bit longer time to study this. It's not something that needs to be rushed in right now. And there are some health chairs like myself who've had concern from day one. I have concern because this bill impacts 4.3 million people in North Carolina. And a lot of those people are state employees that have over many, many years invested in having a state health plan function, and the provider has been Blue Cross and Blue Shield. So if you've had a really good experience with that provider, then you may not have a concern. But if you have invested for a long time and when you need that service, sometimes there has been concerns about how your bills were eventually paid, but maybe it took a very long time for that to happen. Maybe they were not fully paid, depending on the percentage of insurance, you're 80-20 or 70-30. So there is a lot of concern, and as I said today, my phone has absolutely burned up. I could literally show it to you. It's in the room if you want to see it, and it's from all across the state. It's not from Eastern Johnson County. It's not from Western Johnson County. It's from Eastern North Carolina, the Triangle, the Triad, and Western North Carolina. And people of high education, people of just everyday, our citizens that work for their living every day. But there's a lot of people from varied socioeconomic backgrounds that are very concerned about this bill. I think that one of the main concerns that I as a nurse have is that with the provider like Blue Cross and Blue Shield and other providers in the state, we always want to make sure that the bill has oversight. Anything that we put out there that's going to affect the citizens of North Carolina, as a representative, you want to make sure that it has oversight. It doesn't appear, and I'm talking about the current form, it doesn't appear that this bill gives the Commissioner of Insurance the meaningful oversight to protect consumers and the public interest from whatever may happen, and yet we don't know what's going to happen, and this bill does not contain that information. Also, this bill seems to stifle competition on the health insurance marketplace, leaving consumers, which I'm concerned about, with even fewer choices. This company already has tremendous business flexibility and dominates the insurance market here in North Carolina. Under current North Carolina law, Blue Cross and Blue Shield already has 40% of the assets for the nonprofit purposes. Under this bill, the parent non-holding company, this parent company would not be regulated. It would not be a regulated insurance company and could therefore threaten affordability and coverage for millions across the state. That is one of the main concerns of those of us that are health chairs that really have healthcare background. The parent company could also take action, such as investing assets out of state or increasing executive salaries. When we had a conversation with the folks running this bill, this was one of the things that they did talk about, that they would be investing out of the state, which could lead to higher premiums and out-of-state pocket costs, as well as diminished quality of care and services to North Carolinians. By stopping short of a full conversion, which was done in 98, I believe, this company could also withhold information from the Department of Insurance on how its proposed restructuring would impact policyholders. Additionally, the proposed bill authorizes Blue Cross and Blue Shield to drain nonprofit assets that should remain protected for the exclusive purposes of benefiting the health of North Carolinians. There's much more, but I think the Commissioner hit on most of it. The bill provides no information about how restructuring our state's largest insurance company would impact coverage for accessibility, affordability, and network adequacy for the policyholders. And again, there's 4.3 million of those policyholders. As a nurse and as other healthcare professionals that are health chairs, we have concern not about the entrepreneurship of all this. We understand about entrepreneurship. What we want to make sure of is that citizens in North Carolina that have depended on this company and have depended on, will be still depending on this company for another couple of years at least, have access, affordability, and to know that they've got health coverage that's going to be taken care of when they need it, and that they're not going to have to sue to get it. And I probably shouldn't have said that, but they just are very concerned, and these are some of the emails and the content that I've been getting over the last several hours and before this, but today it's been an onslaught. I'm sure they've heard about the press conference. I want to thank Blue Cross and Blue Shield for being a servant to North Carolina for a very long time. We appreciate all that you have done, and we would like to continue doing business, but I just don't believe that this vast bill that's being pushed through by an entrepreneur group that admits when they come and talk with the health chairs, we know nothing about health care, but it's our duty to push this bill through because we are the experts in venture capitalism and all that. So, and I love the person, actually he's my seatmate. So, I think that everybody wants to do the right thing. I just think that it's going to take us a little bit longer to get to the point where the right thing is that we have it in our hands and in front of us. So I appreciate the Commissioner having this press conference. Thank you for letting me be here.
Thank you, Representative White. Peg O'Connell, could you come up? PEG represents a number of groups involved in health care. It seems like it wasn't long ago we were in this room to dedicate it to former Commissioner Jim Long. I see a picture on the wall watching after us. But Peg, would you like to comment on this, your take on House Bill 346?
Thank you, Commissioner Causey. It is very nice to stand next to you in this room between two men wearing red ties. As Commissioner Causey alluded to, my late husband was Insurance Commissioner Jim Long. He was Insurance Commissioner for 24 years. So, and I practiced insurance law for a long time, so I know a little bit about some of this stuff. I want to bring you just a bit of history, why this is such a big deal. Back in the early 2000s, when Blue Cross Blue Shield had considered another type of conversion, they brought a proposal to the Department of Insurance. And at that time, the commissioner had, and still has, unless it gets changed tomorrow, the ability to look at what, if a conversion occurs, what will be the impact on the policyholders and the premiums that they pay. So back in the early 2000s, the Department of Insurance commissioned a study by two very well-known academics, Professor Mark Hall from Wake Forest and Chris Conover from Duke. That study to determine the impact on policyholder premiums alone. So there are so many things in this proposed legislation. Let's just focus on this one thing, the people of North Carolina and how much they pay for their insurance. In the early 2000s, if it weren't all electronic, I would stack up the papers for you. I remember Jim bringing this stuff home and reading it at night. The study determined that, and the study itself took a year. In the current version of the bill, it gives the insurance commissioner 30 days to look at the impact on the premiums in North Carolina. The study took over a year. It was voluminous, but what it found was two major things. This is in the early 2000s, so some smart person do the numbers on what that means in today's money, but it would have cost the ratepayers, what you call them in insurance, or the premium that policyholders pay, $516 million additional dollars if that conversion were to have taken place back in the early 2000s. That's $516 million. That's almost $500 million in increased premiums to be paid by the policyholders of North Carolina. In addition, it would have made insurance so much more expensive that 14,000 North Carolinians would likely have lost their health insurance. And they even drilled down far enough to talk about how many people without insurance might possibly have died simply because they could no longer afford their insurance. So, I mean, I know a lot of you know me recently from talking about trying to get more people insured. Keeping people insured is as important. So that's a little history coming from the Jim Long days in North Carolina when Blue Cross attempted a conversion then. They've attempted some others, as the commissioner has addressed. But you know, we all want our hometown team to do well. We want First Citizens to do well. We want Bank America to do well. We want SAS to do well. But when you're a financial entity and insurance company, you are to be a regulated entity. That's part of the deal. When you're a financial services institution, you are to be regulated. So moving all the money up and out doesn't include that regulation, and that is such an important part of what's been the history in North Carolina and will hopefully be the future of North Carolina. There are, as Representative White said, a lot of people who are very concerned about this. Nobody's saying no right now. Everybody is saying this is so complicated. Let's slow it down and take a look at it to make sure that it's not just good for Blue Cross Blue Shield, but that it's good for all the insurance consumers and the taxpayers in North Carolina. Thank you, Commissioner.
Thank you, Peg, and Sheriff Danny Rogers, I see you in the back of the room. Come on down. I was sad, Sheriff Rogers is my sheriff, the high sheriff from Guilford County. Thank you, Sheriff, for coming. Now, he drove all the way from Wrightsville Beach to be with us this afternoon. The Sheriff's Association's having their convention meeting, a spring meeting, summer, whatever part of one of their annual meetings. I was down there early Saturday morning speaking to the sheriffs. I have Representative White. I will say this: the Johnson County Sheriff Steve Bissell is one of the officers, and he was on the stage. And when I walked up to speak, Sheriff Bissell turned to me and he says, "Now, be sure to tell him who your favorite sheriff is, me." And I got up there and I said, Sheriff Bissell wants me to tell you all that he's my favorite sheriff, but I don't think that'd sit too well with my sheriff, Danny Rogers. So, Danny, you're a great sheriff. I'll tell you, anytime anybody in Guilford County has an issue with crime or if it's just speeding cars, Sheriff Rogers is on it. So I know he didn't know a lot about this bill till I talked to the sheriffs on Saturday morning, but I had quite a few sheriffs express their concern about even the possibility of health insurance premiums going up again with Blue Cross. So if you want to just say hello to everybody, thank you so much.
Well, thank you. Thank you, Commissioner. And also thank you all for being here. I'll probably bring a different perspective. I've been a law enforcement personnel, the sheriff of Guilford County. Just to give you a little history. We deal with a lot of mental health issues. People that are going through mental health crises. We deal with a lot of drug overdoses, fentanyl, opioids. So we look at it from a different perspective when you begin to start talking about health care. And then I have those men and women that have served the Guilford County, citizens of Greensboro, the High Point, Great Area, that have retired or getting ready to retire. They're also going to be needing insurance. They have insurance, but there are things that we're fighting for to make sure when people retire that the insurance continues to go and be in their favor, and not being prices or premiums being risen to the point that where people can't afford it. So when I heard Commissioner Causey talk about it on Saturday, it really threw me for a moment, because I was like, for some reason, I have not heard of the Blue Cross and Blue Shield trying to do what they're actually looking at doing. I believe that everybody needs oversight. I do. When you look at insurance, whether it's a non-profit, everybody's profit when you look at that. When you look at profit or non-profit organizations, everything needs oversight. And I truly, truly believe with the fact that it would impact 4 more million people within North Carolina. We need this oversight, and I think they need to slow the bill down so we can have more oversight and get a chance for the general public to understand what's happening and what's going to happen. So, like I said, I bring it to you from a different perspective. I do support and Commissioner Causey on the effort of what the insurance department is looking at doing and wanted to get done. And I thank you very much for giving me the opportunity to speak. Thank you.
Thank you, Sheriff. Appreciate you coming.
Yes, sir. Thank you.
Thank you so much. Nicole, did you have any comment? We have a lot of complaints that we deal with here from our consumer division, and I've got just 2 or 3, some that's been filed with the Better Business Bureau, and I call the attention. Do you remember back in 2016 there was a number of newspaper articles. This is a headline. David Huffman authored this back in 2016. North Carolina officials swamped with complaints about Blue Cross Blue Shield back when they were having the trouble with computers. This department was overloaded. But I want to call up the executive director for the North Carolina AIDS Network, and I didn't get somebody stole my notes, so I'm going to have you introduce yourself, and if you would tell about some of the issues you've had to deal with. Thank you.
Happy to
Thank
do
you
that.
so
Thank
much.
you. Thank you so much. Good afternoon. My name is Valeria Levy, and I am the interim executive director for North Carolina AIDS Action Network. And thank you all for having me. Several months ago, our team, along with the HIV and Hepatitis Policy Institute, filed complaints to the North Carolina Department of Insurance and U.S. Department of Health and Human Services in regard to the tiering of HIV medications on Blue Cross Blue Shield of North Carolina drug formulary. In the formularies for 2022 and 2023, nearly all of the standard drugs for treatment of HIV have been included in drug tiers with the highest out-of-pocket costs for patients. So essentially 50% of the cost sharing, resulting in possibility of thousands of dollars in monthly costs for people living with HIV in North Carolina. This formulary also places generic HIV medications on the top 2 tiers, including the generic of Truvada, which is a once-daily pill that is issued and used for pre-exposure prophylactics, or PrEP, in the prevention of HIV for folks who do not have HIV. And for what reason other than to discriminate against those who are living with and impacted by HIV? We've come such a long way in the treatment of HIV, with some folks using just a single tablet a day regimen. But we know that our folks living with HIV, to live full, happy, and healthy lives, they must have access to these health-saving medications and life-saving medications. Through this discriminatory tiering of HIV drugs, Blue Cross Blue Shield of North Carolina is effectively trying to discourage the coverage of people living with and impacted by HIV, which continues to further disparities and limiting our progress towards ending the HIV epidemic in North Carolina. In our efforts to end the HIV epidemic, we have to recognize the disproportionate impact that HIV has had on Black and brown communities. These disparities will no doubt continue to grow due to these arbitrary and exorbitant costs. This will lead to negative individual and public health outcomes. One area that causes great concern for our community is the access to prevention services and medications for our Black and brown women. Uptake of HIV prevention medications has been extremely low in Black and brown cisgender women communities, despite the burden these communities continue to face. Of the oral HIV prevention medications available, Truvada and its generic are the only ones available for cisgender women, and through this drug tiering, we will continue to see further gaps in access and implementation of HIV prevention services for Black and brown women throughout the state of North Carolina. Though Blue Cross Blue Shield has received our complaint and said that they are opposed to discrimination of any kind, these high-tiered formularies for HIV medications remain. The job of Blue Cross Blue Shield North Carolina, as the largest provider of insurance coverage for North Carolinians, is to provide equitable and affordable access to life-saving health care for their patients. It is past time for them to be held accountable and to stop putting lives and financial sustainability of North Carolinians at risk. Thank you all for having me here today.
Thank you, Rebecca.
Thank you.
Thank you so much. And that's all, unless any of you in the press have any questions, we'll stick around. I did print out two of the Better Business Bureau complaints, and then we had statistics on ours if anybody has any other questions. Anybody else have anything you want to share? Well, thank you for coming. Thank you all for being here today to listen to us. Thank you so much.